You. Former President Joe Biden's prostate cancer announcement is raising awareness about the disease.
That's right. UCLA researchers say that their new findings can help some patients manage their prognosis more comfortably. Joining us now, Dr. Leonard Marks. He's a professor of urology at UCLA Health. Thank you for being with us this morning, doctor.
Thank you for having me.
Yeah, and I'm sure you've gotten lots more questions about prostate cancer since former President Biden's diagnosis. A lot of people surprised that he could be diagnosed with such an aggressive form of cancer for someone who goes to the doctor regularly. So explain how that could happen and what some of the signs are that people possibly could see.
So it's all about the PSA. I read that his last PSA was 10 years ago or more. PSA is the primary way prostate cancer is detected. Nowadays, symptoms, as he has developed, are very late findings. We don't want to find this disease in the symptomatic stage. We want to find it in the silent stage when it can be cured. His is not curable. PSA testing has gone through an evolution over several years, many years. It was discovered in the 70s, rose to prominence as a test during the 80s, was approved by the FDA in 1986 as a test for prostate cancer, and has waxed and waned over the years. But in 2008, a quasi-governmental panel recommended PSA testing should not be done, that it was not necessarily, and problems increased. And we're at a stage now where the recommendation is that shared decision-making should be experienced between patient and doctor to determine whether that patient wants to be tested. Most patients should be tested.
Well, the current guidelines advise no screening after the age of 70. Do the guidelines need to be re-looked at?
So it depends which guidelines you're talking about. There are various authorities have issued different guidelines. The American Urological Association has its own set. I am a believer in biological age rather than chronological age.
Okay.
And if a man is healthy, a 70-year-old healthy man has a 10 or 15-year life expectancy, prostate cancer would catch up with him during that period.
Okay.
Should be screened.
Okay. Let's talk about some new research which talks about focal therapy. What is focal therapy and how can that help?
So it's all about the MRI. To identify and localize prostate cancer within the gland.
Okay.
When we can do that, and this started about 10 or 15 years ago, MRI became available. Focal therapy is a way to destroy a cancer before it can get large enough to require surgery or radiation therapy. This is a coming offering between active surveillance, which is to simply watch the patient, and radical surgery or radiation therapy. It's an it's attractive because it has very few side effects.
Well, and radical surgery can really be devastating to the patient and other aspects of their life.
Surgery or radiation therapy both have their known potential complications. These have become much better known, and the point is to minimize treatment, to preserve quality of life. Quality of life is such a big thing to men with prostate cancer.
Yes.
So our goal is to preserve quality of life, offer a good chance of cure, or to avoid treatment altogether if treatment wouldn't be helpful.
Okay.
All right.
It's fascinating.
It is.
Thank you for being in here. We really appreciate you talking to us this morning.
Thank you.
Thank you, Dr. Marks.